So number one, you would open the divergent channel, the yin side or the yang side of things, the root first. Then you would balance the other side, which is the yang partner side. Hey everyone, Dr. Richard Lai here with Study Acupuncture With Me. Welcome back to the channel, and if you're new here, I welcome you. My name is Richard, and I am a physical therapist, and I'm also a licensed acupuncturist. Now, if this is your first time here, let me tell you what we do here at Study Acupuncture With Me. So we make content related to acupuncture that I hope that it helps you understand traditional Chinese medicine, not just for the sake of passing the board exam, but so that you can take these clinical skills that you learn and apply it as clinical knowledge when you become a fully fledged acupuncturist. So you don't just memorize everything for the board exam and then forget everything once you pass the board exam, but you actually remember it and help your patients. So this episode today, it actually comes from a request from one of the listeners of Study Acupuncture With Me named Manya. Now, Manya is a current student who studies at the 8 Branches College of Eastern Medicine in Toronto, Canada. Woo! And Manya said, "Hello, Dr. Lai. I hope this message finds you well. I am a huge fan of your podcast. I learned from your informative videos and contents that you are providing that I didn't learn in my program. I truly appreciate your hard work and passion. Thank you. I am studying at 8 Branches College of Eastern Medicine, Toronto, Canada, to graduate as a registered acupuncturist. I am graduating this December. My question is regarding Divergent Channel. Can you please have a video regarding a case that a divergent channel is used? I read that it is used in chronic conditions and balancing yin and yang, but I don't know how an acupuncturist should choose acupuncture points to balance yin and yang. Can you please give an example of a case study of how we would choose points? For instance, to balance yin and yang of heart and small intestine, and which meridian points should we choose? My name is pronounced Manya, but in my passport was written Mania, which means crazy. Best regards, Dr. Lai." Well, Manya, we are all a little bit manic, especially as we get into the last part of 2025. So Manya, thank you for sending that email. Manya actually sent that back in June of 2025, and right now it is September of 2025 when I am recording this. So I appreciate your patience with this, Manya. I appreciate the kind words as well. I'm honored that Study Acupuncture With Me helps you to fill in the gaps that you don't get in class, and that's actually literally one of the main reasons why I created Study Acupuncture With Me, because when I was in school, there was a lot of gaps. And a lot of times when you ask a question, you might be met with, well, that's just how it is. And you don't really get an explanation as to the why. So I had to look into the books and everything like that to figure things out. And I wanted to be a resource for everyone out there so that you don't feel lost as you're going through acupuncture school, because it is literally a different language that you're learning. So the more you can understand it, the better patient care that you will be able to give in the future. So Manya's question is about divergent channels, and basically Manya's asking for a case example. And so yes, we can totally do that. And as part of this episode as well, I will put on the studyacuwithme.com website a free PDF that has just a bunch of different cases. So in this episode, we'll talk about one case, but in that PDF, you can get a bunch of different kind of cases. So just go over to studyacuwithme.com and you'll be able to see it right on the front page. So before we get into the case though, I feel like we should go over some of the basics of divergent channels. So that way everyone is on the same page about what a divergent channel is and what it does, like basically the who, what, where, when, and why. So this way we can all be on common ground. Now, before we get into all the nitty gritty of divergent channels, we should do some broad stroke layout of the land. So in general, divergent channels, like Manya said, they connect yin-yang pairs. They are related to something with an imbalance with the yin-yang. So what they do as a function is that they connect yin-yang paired organs. So whatever divergent channels are, one of the most important functions that they have is that they strengthen this connection between yin and yang, meaning the yin and yang paired organs, at a very deep level. Now, another general thing about divergent channels is that they all separate from their primary channel at a major joint. So they all separate from a primary channel at a major joint. Another general thing about divergent channels is that they all diverge from the primary channel and then they dive deep. So that's why they're called divergent channels. They diverge and then they dive deep. And then they go through and enter at least one zangfu organ. Basically, yin channel divergence, they're going to go and enter their yang paired organ. And yang channel divergence will go and enter their yin paired organ. So this is why the first function that we talked about is that they reinforce or they strengthen the yin-yang pair relationship because they connect with the yin-yang pair organ. Now, divergent channels, for the most part, they will also connect with their own organ. So, for example, the heart channel, the heart divergent channel, it will connect with the heart. And then it's a yin channel divergent, so it's going to connect with its yang paired organ, which is the small intestine. Another thing about the divergent channels is that after they split off from their primary channel, after they dive deeply into the body, into the zangfu, divergent channels are going to resurface. So they will resurface specifically in the head and neck area. So they'll reconnect with themselves if they're a yang, or they will reconnect with their yang counterpart. So for example, the heart divergent, it's going to resurface at the neck and it's going to connect with its yang counterpart, which is the small intestine. Urinary bladder divergent channel will resurface at the neck and it's going to reconnect with itself as a yang divergent. And another general thing about the divergent channels is that, like Manya said, they will treat chronic or complex issues. And they will basically harmonize all of the yin, the yang, because they diverge off of the primary channel. And they dive deep into the body and then they come out again. So that's like a yin and then a yang direction as well. So it basically covers this whole entire spectrum of channels, of yin, yang in terms of harmony. All right, so now let's break down the divergent channels even further by asking the who, what, where, when, and why. So who and what are the divergent channels? So divergent channels are these channels that diverge from your primary channels. And we already know that we have 12 primary channels. We know them really well. You know their pathways really well as well. Like for example, the lung channel. You know it has 9 points. You know that the channel basically starts from your pec minor area, your shoulder area, goes all the way down to your thumb. That's the lung primary channel. You also have your large intestine channel. Basically, this one starts where your lung channel ends. So it starts around the area of your index finger, goes up your arm, goes to your shoulder, goes up your neck, and ends at your opposite side nostril at LI20. So with these primary channels, you can think of them sort of as highways. They connect from one place to another, and they bring chi, or they bring you from one place to another. And so your body uses these pathways to distribute chi from one place to another. Now, let's say though that you are going somewhere and you need to get something from somewhere. You need to do a side quest. So that's where divergent channels fit into all of this. So you're driving on the highway and maybe you need to do a side quest. You need to pick up some bagels. Or maybe you run into an interference, like you hit traffic, or there's an object in the road, or you just, you need to do the side quest. You need to go off the beaten path and you're picking something up from in town. So what do? You diverge from the main highway and you start to take an exit, you take a side road, you take a back road, you get what you need, and then you go back onto the main highway to get to your destination. So that's literally what a divergent channel is. It is a channel that diverges from the main channel and it goes to a specific place, which the place is what we'll talk about now, which is where are divergent channels. So where are divergent channels? So in terms of where, divergent channels, they diverge from their primary channel near a major joint in your body. So for example, your major joints are your hips, your knees, your shoulders. And location-wise, each divergent channel is going to separate from the primary channel near your shoulder or your hip or your knee, depending on which divergent channel that you're talking about. And then from that diverging point, that divergent channel is going to travel deep into your body and it's going to connect with, number one, its own organ. So for example, the heart, it connects with the heart. The small intestine, it connects with the small intestine. The urinary bladder, it connects with the urinary bladder. Now, number two, some divergent channels will also have bonus connections. So for example, the bladder divergent channel will also go to the heart. And then lastly, after all of those deep internal connections that the divergent channel goes on with the zangfu, the divergent channel will either rejoin themselves if they are a yang divergent channel, or they will rejoin their yang pair. So for example, heart. Heart is what? Is it yin or is it yang? It is yin. Heart divergent will resurface and rejoin with its yang pair. The yang pair would be the small intestine. Now, if you look at, for example, the urinary bladder channel, now, depending on whatever source that you use, you might have some slight variations, but I wouldn't get frustrated on that. I would not get too hung up on that. Just know that in general, where does this divergent channel separate and where does it go? So urinary divergent channel, it separates near the knee at the popliteal fossa around UB40. That's a major joint. The knee is a major joint. And the urinary bladder divergent channel diverges from the primary channel there. Now, the back road is that it goes through the thigh, it goes to the Zangfu organs. And so because this is the urinary bladder divergent channel, where is it going to go? It's going to go to the urinary bladder organ, and then it's going to go to the kidney organ. Now, after that, the divergent channel is going to go up the spine. It's going to hit your cardiac area. It's going to go to your neck. And what is it going to do? It's going to rejoin with the urinary bladder. So that's an example of how this divergent channel is going to separate from the primary channel near a major joint. And that's an example of the back roads or the side roads or whatever you want to call it that it takes, where it goes deep internally to the Zangfu, connects with its yin-yang pair, and then it goes up and it comes out with its own yang channel. So hopefully that shows you how divergent channels strengthen or reinforce the connection between interiorly and exterior related channels or yin-yang pairs. And hopefully that explanation shows you why we use divergent channels when normal channels might not cut it, because you need that back road to accomplish your side quest basically. Which that actually brings us to when. So when do we use divergent channels from a clinical perspective? So we use them when the primary channel just isn't enough. And so for the most part, this is going to be, just like Manya mentioned, when it's a chronic condition or it's a complex condition. Now, a chronic condition means something that's lingering. It's not in the acute phase anymore. It just feels like a stuck issue that's not going away. And so what will we do? We will deploy the divergent channel to treat that lingering symptom. Now, another time that we would use divergent channels is when there's a latent problem. So what is a latent problem? I actually just finished a lesson for the board prep course on latent pathogens. So basically, a latent pathogen is when you have a pathogenic factor that you're treating and you don't fully expel it. And what happens when you don't fully expel it is that it actually hides in your patient's body, deeply in their body, and it remains latent or dormant. And sometimes months or even years later, when your patient's in a weakened state, that pathogenic factor comes out to play again. So it resurfaces again after it was dormant for all this time. And it causes these weird lingering symptoms. So in that case, we can use the divergent channel because most likely the pathogenic factor hid in the divergent channel pathway. And that's how it got deeper into the body. And another time you would use a divergent channel is when you need to balance yin and yang. Now this sounds really basic, and Manya asked this question specifically, and you can get as complicated as you want about this one. And I will have a PDF for you. If you want to download it, just go to my website, www.studyacuwithme.com. You'll see it on the front page there. You can download this PDF. The premise to know is that for the divergent channels, the entry point and the emphasis in terms of yin and yang is going to be different for each divergent channel. So, for example, for yin divergence, they emphasize drawing yin inwardly to meet yang. And for yang divergence, they emphasize drawing yang inwardly to meet yin. And for me, it actually took some time for me to understand that. I just said it over and over again. I slowed it down and I tried to chew it and digest it as much as possible. So I'll say it again slowly. Yin divergence. They emphasize drawing yin inwardly to meet yang. Yang divergence. They emphasize drawing yang inwardly to meet yin. So an easy example of this would be if there's a disharmony between your spleen and your stomach. So basically your patient is coming to you with a chief complaint of loose stools, poor appetite, they're bloated, and they also say they have a headache, a frontal headache, and they have sinus issues. So basically they have spleen issues with the loose stools, the poor appetite, the bloating. They also have stomach issues with the frontal headache and the sinus issues. So in this case, you would have to work on both. You would have to work on the spleen and the stomach. And you can use either spleen divergent or stomach divergent. And you want to harmonize these two interiorly exterior related pairs, the spleen and the stomach, or the yin and yang. So now the question is, which one would you use? Which one's better? Now, in this case, we would want to use spleen divergent because the yin divergent channel, remember, it emphasizes drawing yin inwardly to meet yang. And here, with this patient that's coming to you, their chief complaint is, or their main root issue is spleen deficiency. This spleen deficiency is causing the loose stools, the dampness, and this dampness is accumulating in their body, and the dampness is overflowing into their stomach channel. That's why they're getting the sinus issues. Like they could be saying that they have sinus congestion. That's why they're having a frontal headache. That's all the yang ming or stomach channel area. So when we use the spleen divergent channel, we're basically choosing to start from the yin side of things. And the spleen being the one that's deficient, we're drawing spleen yin's essence inwardly to help nourish and stabilize the spleen, which this will allow the yin to temper the stomach's yang, which we see basically flaring in a negative way towards the head. That's why we see the sinus issues. That's why we see the frontal headache. Basically, another analogy that I just thought of is you have two dancers. You see two people dancing. One of them is a very yin person. One of them is a very yang person. The yang person on the dance floor, they're going crazy. They're doing backflips. They're twirling. They're doing all these crazy things. The yin person helps to ground them, helps to keep the beat, while the yang person is doing all the flaring. So in this case, with spleen deficiency and stomach excess, the spleen is the yin side of things and is weaker. So the spleen as a dancer is going to go and sit down. The stomach then isn't being rooted, isn't being grounded. So the stomach is just on the dance floor, woo, going crazy, doing backflips and twirling and doing all this stuff. So that's what the frontal headache is. That's what the sinus issues is. So what can you do? You have to get the spleen to come back to the stomach and calm it down. So you can use a divergent channel, which when you're doing that, you're basically walking that spleen, nourishing them, getting them back on the dance floor by replenishing them and getting them back to harmonizing with the stomach to harmonize yin and yang. So when you start with the spleen divergent channel, you are drawing yin inwardly. You want to nourish the yin side of things first. That way, it grounds and roots the yang side of things. All right, so now let's use Manya's example. So let's say we have a patient who's coming into your clinic and everything they say, it's making you say, okay, heart is definitely involved here. So they say, hi, Dr. So-and-so, I've been having insomnia. I've been having night sweats. My mind, my heart, they just don't feel like they're resting. So basically they're saying that something is up with their heart organ. Now, they also tell you that they have a stiff neck, that they have shoulder pain, that they can't move their neck really well. And lo and behold, on the board exam, it might say something like they have an issue along their small intestine channel. Or they may say that they might put a landmark, like above their crease of their shoulder. So here's where the divergent channel can come into play, because a divergent channel treatment would perfectly treat this issue because you have a heart and small intestine issue going on, which is this interior-exterior pair, and they have some form of imbalance between the two. So we have this heart with the anxiety or the restlessness, and then the insomnia, the night sweating, and then we have these issues going on along with the small intestine channel. So we know that this is the case for the divergent channels in that way. So now the next question then is, how do we choose points for this? So this is Manya's question. So in the easiest way is we have to know point location. And basically we would always start with the source, which in this case, the root of the problem is the yin side of things, which is the heart. That's the patient's main complaint. And so we have to dig into our knowledge of point location in terms of where is the divergent channel? Where is the divergent channel of the heart? Where does it separate? And we know that already with divergent channels, they will branch off at a major joint. And so for the heart, this divergent channel actually branches off right at the axilla, which is under the shoulder. And so how do you know where the divergent channel areas are? So in my schooling, we use the Deadman textbook, which it shows you where each divergent channel separates, and the Zhangfu of where it enters and where it rejoins. So for the heart, it says that the divergent channel, it separates from the primary channel at the axilla, and it reconnects with the heart, and then it reconnects with the small intestine at the inner canthus. So we would want to choose a point close at where this branches off, which is literally in the axilla. So what points do we have from the heart in the axilla? We have heart 1. So we can use heart 1 to open the divergent channel, and this gives us access to all the divergent channel benefits. Now, the next thing we want to do is we want to connect that yin point that we're using with the paired yang channel point. So we're using heart 1, and the paired yang point or yang channel would be small intestine. Now, small intestine divergent channel, according to Deadman, it separates from the primary channel at the shoulder, and it enters the axilla, and then it crosses to the heart, goes down to the abdomen where it's going to connect with the small intestine. After this, the divergent channel is going to ascend to the inner canthus of the eye, which is where it's going to connect with the urinary bladder channel. So since we know that the small intestine divergent channel separates at the shoulder, we should choose a point that's close to that area. So along the small intestine, near the shoulder, a good popular point that we use would be small intestine 10. It's a popular point we use when we're addressing any shoulder pain and neck stiffness anyway, so we can use that point to access the small intestine divergent channel. So we have a yin side, which is the heart 1, and then we also have a yang side, which is small intestine 10. Now for your treatment, you can just stop there, but you can actually make the treatment even better. So you can follow this general clinical workflow. So basically you can also add in addition to this yin divergent and yang divergent, you can also add in a dew point and or a Ren channel point. This way you actually tie in the yin and yang axis of the body. And that way this also broadly harmonizes the patient from a whole body perspective in terms of yin yang. And then the last thing you can do is actually to bring in a broad harmonizer, a general harmonizer, basically a constitutional supporting point, like a stomach 36. So if you look at this from an eagle eye view, the clinical workflow basically is that you open the divergence, you balance between the two, which you would choose a point from the yin divergent channel side. You would also choose a point from the yang divergent channel side. And then you would also stabilize the whole body by choosing a point on the Ren or the dew or both. That way you support the yin yang axis. And then lastly, you would support them from a whole body perspective by just choosing some sort of general harmonizer. So for this example, you can use heart 1, you can use small intestine 10, you can also use dew 20 or Ren 14, since there's like heart issues, anxiety issues, restlessness issues. And then you would choose a whole body or general yin-yang harmonizer like stomach 36 or spleen 6. So spleen 6 would be like a whole body yin tonifier. And actually for heart and kidney, there's a pattern called heart and kidney not communicating, which one of the points that we use there is kidney 6. We can also use heart 7. So those 2 points, either one or the other, would also be a good whole body general harmonizer. And it would actually also help you in terms of facilitating communication actually again between the heart and the kidney. So do you use all 4 steps of this pathway? You could if you wanted to, depending on the patient. You can add all 4 clinical steps, or you can just stop at the yin and yang divergent channel opening points. The important thing is basically just to be able to recognize what is the source of the problem for your patient. You always want to start there. What is their chief complaint? So you want to start either you're bringing yin in to access the yang, or you're doing the opposite of bringing yang in to access the yin. So you're balancing between the two by choosing the pair. Alrighty, well, Manya and everyone else, I hope that this helped you make more sense of the divergent channel. I hope that it made it more clear in terms of who and what divergent channels are, how to choose points, and I hope that 4-step clinical pathway helped you. Now, if you remember nothing else from this episode, remember this as a basic point. Primary channels, they're like highways. They carry qi from one place to another, they carry blood from one place to another. Divergent channels are side roads or back roads. They branch off of the primary channel at a major joint. They dive deep into the organs and they resurface in the head and neck area. And then clinically, remember the workflow that we talked about, which is the 4 steps. So number 1, you would open the divergent channel, the yin side or the yang side of things, the root first. Then you would balance the other side, which is the yang partner side. And then you can stabilize using a ren or a dew point. That way you anchor the person in terms of a whole yin-yang axis. And then the last step of the 4-part clinical pathway is that you would use general harmonizers like a stomach 36, spleen 6, or heart 7, or kidney 6. That's how you use the divergent channels. So Manya, thank you for the wonderful question. And to everyone else, if you have a question like Manya, feel free, you can leave it in the comments on my social media. I have a running list, and even though this video was not posted immediately, I have the list and I'm getting through them because I want to be there for you. If you want to email me as well, you can do that. You can email info@studyacuwithme.com. And then before we end, I want to remind all of you to sign up for my Quick Win newsletter, which you can get one board style question in your email with a full explanation every single week to your mailbox. It's easy, it's a 5-minute read. I write it with the hope that you'll just have a quick win and a boost in your confidence in terms of your board prep. All right, everyone, until next time, God bless and happy studying.